It's a big change for us in the way of doing business.
What we've done in the past, people coming back into the system, we weren't really fixing that.
When AB 109 first came about, it was kind of a shock. Wow, we're going to get all these guys out of prison to supervise them.
Methamphetamines has always been my downfall.
It's a culture change for all of us, for the offenders and for the probation officers involved. And, you know, it used to be the old days, you'd sit across the desk from the offender and you spend 5 minutes with him, chewing him out, basically.
I was involved in drugs since the age of 15, and I've been going in and out of prison, and I didn't know where to get help at.
I was just a number. You know, it didn't matter what I had going on in my life, or how good I was doing, or whatnot.
Now the officers, they're able to spend much more time working with these individuals and actually have a direct impact on them.
The clients are receptive to it because they see the support that we have as a unit with the case managers in court, the commissioners that are there, the public defenders, the program providers. We all work together in an effort to help them. And I see such a difference with them because when we do talk to them initially, they're real standoffish. They didn't really want anything to do with us. When they see that there is help, that we are helping them, then they become more relaxed.
Parole has always been around to help protect the citizens from me, whereas this probation has been geared more towards helping me become a citizen.
When you talk to them with respect, they're going to give you respect and they're going to be motivated to change instead of feeling like they're being told to do something.
This is an excellent program for a guy like me who wants to change. You're not going to have to worry about me going into back into prison or running out there stealing your stereo. Man, if I could have done this 10 years ago, I could have, you know, prevented a lot of heartache, a lot of pain, violation, you know, security for all the victims, all of my family, myself.
Realignment's having a big impact. To try to change these individuals, to have an impact on them directly, to reduce recidivism, and you can see how effective it is.
Well, there's a lot of things today due to the programs that AB 109 has put me through that I've learned about myself. I had to change. I had to change who I was. I've taken responsibility. If it hadn't have been for me, that wouldn't have never happened. If I hadn't have been there, it wouldn't have never happened. So it's all me.
This is our Adult Day Reporting Center. So what we have here is a variety of services that are offered to a group of offenders, both AB 109 and general probationers. Our officers facilitate evidence-based classes here, which is a huge change. And we have many different groups going on, including anger replacement training.
I caught a case of domestic violence. 16 months is a lot of time to think, you know, and I've never been to prison before, and that was a big eye-opener for me. I got out and then I reported to probation, and I had to go to a domestic violence program. They teach you a lot of things in that class, you know. They teach you really think about your actions before you act. It's a group dynamic, you know. Everybody puts their information in, and I learned something from other people, and you know, you share your story with other people so you can learn.
So this is one of the spaces we utilize here in the Day Reporting Center for our clients. We have computers available for their resources. They can do job searches, work on resumes, do homework, other things that are required. And what you'll also see is we have rooms on both sides of this space here. And in these rooms we run small groups, which could be different kinds of classes or counseling sessions that are ongoing, both run by our probation officers and by outside resources and community-based organizations. This is an actual classroom where we have actually individuals from 18 to 24 that are working on their general education diplomas.
In this classroom, we give students the opportunity to earn a high school diploma, or we give them the opportunity to take the GED. I've noticed that the students who earn their diploma or their GED have a higher rate of going on to vocational, technical, or academic school, college. I enjoy seeing them graduate, get high-paying jobs. I've got students who are now moving up and have $20, $30 an hour paying jobs, and they come back and they're ecstatic.
This is our San Joaquin County Assessment Center. So as part of our one-stop shop here in the Assessment Center, we have multiple agencies we work with to provide services to our clients.
They're able to go through WorkNet, the behavioral health services.
And that helps identify their mental health needs. It helps set them up with medication and appointments with mental health to provide them services also.
behavioral health staff, they're in email contact with us if our client's having a problem or needs assistance with something. We don't have to wait for something to happen. We have those people emailing us, letting us know that the client has needs and what they are.
We have the HSA, Human Services Agency, which helps establish benefits for the clients, maybe it food stamps or housing or general relief assistance.
And also we provide transportation for some of the clients. That if they need transportation, we can get them bus passes to get downtown or to wherever they need to get back to.
We have 2 officers assigned to the assessment center. They do the assessments strictly on the AB 109 clients, which helps us identify their needs.
It's worked really well in that we get clients in the door and we get them assessed.
It helps us determine what their risk factors are. So what areas create the most problems for them, be it substance abuse or negative peer associations, and we call those criminogenic risk factors. And so what we try to do is match up those risk factors with programs to address them, so we meet those needs to change that behavior. And the evidence shows, one of the doctors we work with, Dr. Latessa, out of the University of Cincinnati, has shown that these evidence-based programs have an impact on these individuals and actually do reduce recidivism.
I encourage other counties to try a program like this.
There's been some things that we've learned that would be helpful to other communities. First of all, I realize that it's a journey, that it is culture change.
If something's not working, then there needs to be a change. It's clearly been a huge change in all of our jobs and the way we do business, and it's helped a lot of clients.
It's not going to happen overnight. It's something that has to be constant, and you have to work with the different programming factors.
And we're not there yet. We still have a lot of work to do. We have a lot more programs to develop. We'll get a lot more involvement from the clients that we are serving. So I think to be patient, to work with the community. We work with a lot of community-based organizations here to get them involved, because these individuals have to be part of their community and have some ownership. So we work with the communities, we work with local law enforcement, and work with our officers to try to change their way of thinking, to get them to believe in the system and to believe in our assessment tools and our programs we utilize.
We know it's working because we're closing cases out after a year with no revocations, and they're successfully programming and not having any issues. They're becoming employed, slowly, but they're becoming employed, and we're working within the system to get them success.
So everything's right here in the probation. They have everything set up for you, so you got to take advantage of it.
I like to see myself get a house, start a career, and be there to support my family and loved ones.
I would invite any community to come visit our department down here in San Joaquin County. Come see our assessment center, our day reporting center, our programming center, and see what we're doing with these individuals, how we're working with them, how our business has changed. I think that we're a good model for other counties, and I think that our effectiveness is starting to show, and we're being recognized throughout the state as leaders in the area.